All right. I think we're ready to get started again. I know everyone's going to be starting to file in. I'm really excited to announce our next session. And in this next set of presentations, we're going to hear some additional perspectives. The role that access to nature plays in supporting our well-being, what we're learning from our school programs across the country. And then we're also going to hear from some experts who put all of this research into action in school and community programs all across the country. So we really look forward to this great lineup of presentations. And for, again, those of you that are online, feel free to submit your questions via Zoom, the Q&A function. And for those that are in person, we'll reserve some time at the end after each presentation. So we're going to open this session with a presentation from Dr. Sumita Sharma. She is a double board certified psychiatrist in both adult and child and adolescent psychiatry. She currently serves as an assistant professor at the University of California, San Francisco, in the child and adolescent psychiatry department. Dr. Sharma completed her adult psychiatry training at Harvard Medical School, Beth Israel Deaconess Medical Center, and her child and adolescent psychiatry training at UCSF. Her research focuses on nature-based mental health interventions for youth, combining her love for the outdoors with her clinical practice. Dr. Sharma is dedicated to holistic and psychopharmacological approaches to help patients unlock their innate strengths and build enduring resilience. Welcome, Dr. Sharma.
Hello, thank you so much for having me. My name is Dr. Sharma, and I'm an assistant professor of child and adolescent psychiatry at UCSF. And I'm very excited to be presenting about the relationship between nature and mental health. And before we dive in, I just wanted to express my gratitude to my mentor, Dr. Nushin Razani, who unfortunately couldn't be here today, but has played a significant role in shaping this presentation, as well as my knowledge about nature-based interventions. Next slide, please. I have no disclosures to report. Next slide. And by the end of this presentation, I'm hoping you will have a deeper appreciation of the benefits of nature on mental health while still understanding the existing gaps in literature, be able to explore the relationship between nature, diversity, and inequity to better comprehend its significance in the populations we all work with, recognize the significance of assessing scalability and inclusivity of current nature-based interventions for promoting equitable access and maximizing their impact, acquire practical strategies for incorporating nature-based interventions into clinical, educational, or daily practice. Next slide. I wanted to first get started with a visual representation of how this field has completely taken off over the last 50 years. I assume a lot of people here have had their own intimate relationship with nature and intuitively understands that nature is beneficial, and that's probably why you're here today. But the science behind it is finally catching up. And research is increasingly demonstrating the positive effects of nature on mental health, highlighting the importance for us to better understand this relationship. And I'm so excited that this field is rapidly expanding because it means nature's benefits are officially on the world's radar. Next slide. There's a wide range of positive outcomes associated with nature, and it's actually benefiting individuals at every stage of life. You can see all the benefits here, but I'll just mention a few. During the prenatal stages, being in nature has been associated with improved maternal blood pressure, potentially creating a healthier environment for both mother and baby. For children, spending time in natural environments has been linked to enhanced attention span, which can contribute to better learning and development. In adolescents, exposure to nature has been associated with increased well-being, a sense of calm and happiness, supporting mental health and wellness during this transformative stage of life. And in adulthood, nature has been associated with positive effects on conditions such as cardiovascular disease, diabetes, depression, or anxiety. And even in old age, spending time in nature may help maintain cognitive function, and particularly working memory. Next slide. Nature also extends its benefits to communities, and it's been associated with increased social interactions, reduced crime rates, improved community mental health, and economic benefits. And it additionally fosters a sense of environmental stewardship. Next slide. And this is particularly important in this day and age, where recent studies have highlighted a really concerning trend. There is a dwindling connection to nature amongst today's younger population. Compared to approximately 2 decades ago, children are spending significantly less time outdoors. And we're all seeing this play out in our day-to-day lives, clinics, and schools. In fact, the average child now engages in less than 30 minutes of unstructured outdoor play per day while devoting over 6 hours to screen time. This is disheartening and concerning. Evolutionarily, the human existence has primarily been intertwined with nature, and it is actually only recently that we have adopted this way of life. So it's in our nature to be in nature, and my hope is that nature-based interventions will be able to show a promise for us to reestablish that connection and foster a stronger bond with children and their environment. Next slide. And while I always want to celebrate the progress that has been made in this field, it's still crucial that we acknowledge and understand the existing gaps that we have in our knowledge. One significant gap is the predominance of cross-sectional studies. And while these studies are still compelling, and some have actually looked at entire populations of people, they provide limited insight into causality. So we do need more experimental studies that can shed light on the causal relationship between nature and mental health outcomes. Furthermore, there is a scarcity of research specifically evaluating mental health interventions in youth, which highlights the need for more targeted investigations in this population. Another critical gap is the lack of information on scalability of nature-based interventions. So while we can recognize the potential benefits, it is essential to understand how they can be effectively implemented and scaled up for broader population health impact. So by addressing these gaps, we can potentially deepen our knowledge of the role of nature in mental health and develop evidence-based interventions that can ultimately harness the transformative power of nature and address the needs of our youth population. Next slide, please. This slide has a lot on it, but it's really mainly here to give you a sense of the proposed mechanisms by which nature improves mental health. And it's based on a systematic review on green and blue spaces on preventing anxiety and depression in youth from ages 14 to 24. And essentially, the relationship between nature and mental health is quite complex, and it's difficult to establish a single causative link. But some mechanisms that have been identified by this framework include behaviors that are facilitated by green space, so physical activity or big open spaces for children to run around and develop mastery or take risks, or a location for mindfulness. Environmental factors such as decreased air pollution and noise. Social factors, I mean, we all know that social connections play a very important role for mental health, and psychological processes, so potentially having decreased rumination in these spaces. All of these things play a role. Next slide. And in addition to the framework that I showed in the previous slide, there are a few main theories that have been developed to understand this relationship. And the first is the biophilia hypothesis, which proposes that humans possess an innate and instinctive connection with nature due to our evolutionary history. It suggests that our affinity for nature is rooted in our biology, and connecting with nature is essential for our physical and psychological well-being. The next is Kaplan's attention restoration theory, and this is linked to many studies around improvements in attention and cognition. And he suggests that in urban environments, with their attention-demanding stimuli and multitasking requirements, this can lead to mental fatigue and decreased attention. But natural environments offer stimuli that effortlessly capture our attention and allow for the restoration of cognitive resources by providing us with a break from directed attention. And this is something that I often use in my clinical practice to educate families about how this can relate to my patients of all children, and especially those with ADHD. Lastly, there's a stress reduction theory, which emerged from Ulrich's psychoevolutionary theory. It states that natural environments can help lower our neuropsychological stress, which ultimately has a calming effect and can be beneficial for well-being. And according to this theory, humans evolved to experience and recover from stress in nature more effectively, so we can return to a baseline state of calm more quickly in natural settings. This capacity for rapid recuperation from stress may have actually been advantageous for early humans, favoring those who could quickly adapt to nature's restorative effects. So in summary, all of these theories are really intertwined, but the stress reduction theory is referring to more to the physiological stress, while attention restoration theory is really referring to that mental fatigue. Next slide. Now, I wanted to point you to a few seminal articles in the nature world, but I might go over them a little bit quickly for time's sake. But this first one here I want to touch on was by Roger Ulrich, who I mentioned in the previous slide. He was an architect who was the first person to get nature on the radar scientifically. He was inspired by having a childhood illness, which made him sit in hospitals for prolonged periods of time. And he conducted a study where patients recovering from surgery faced either a brick wall or nature. And patients with nature exposure had shorter hospital stays and needed less medication overall. And this article was really what sparked discussions about nature being restorative in a scientific sense. Next slide. This next study investigated the impact of nature on amygdala activity, which is the processing center for emotions. They took 63 healthy participants and they underwent fMRI scans during tasks that induced fear and social stress. After, they were assigned to either a 60-minute nature walk or an urban walk. And you can see that what those walks look like on the top right of the screen. And then they repeated the fMRI scans. And results showed that they had decreased amygdala activity after nature walks, highlighting the therapeutic potential of nature-based interventions in promoting mental health and stress reduction. Next slide. The next study was performed at the University of Illinois, Urbana-Champaign, and it looked at the impact of outdoor walks in parks on children with ADHD. They found that a 20-minute park walk significantly improved children's attention and cognitive performance levels, with effect sizes of 0.52 and 0.77 when compared to exposures in downtown and neighborhood environments, respectively. And these improvements were observed across various measures of attention, suggesting a broad positive impact on cognitive functioning. And to put these effect sizes into context, researchers found that these were comparable to effects from widely used ADHD stimulant medications. And these are one of our most effective medications in the child and adolescent psychiatry world. So, for example, the effect sizes of Metadate, CD, and Concerta were 0.59 and 0.54 respectively. And this is not to imply that a nature walk would necessarily replace or be more effective than a medication, but these findings really suggest the potential of a nature-based intervention as a complementary approach or a preventative approach to enhancing cognitive performance in children with attention deficits. Next slide. And then lastly, this was an exciting study that was done at UCSF, and it was examining the impact of weekly park visits on stress and loneliness levels among low-income parents. So they had 78 participants who were randomized into either a supported parks prescription program or an independent parks prescription program. And essentially both parents, so from both groups, received physician counseling on nature, maps of local parks, a journal, and a pedometer. But the supported group received an additional phone and text message reminders to attend 3 weekly family nature outings that had free transportation, food, and programming from the local parks district. And what was interesting was that they found significant reductions in stress and loneliness that were observed after 3 months of park engagement, regardless of the group assignment. And surprisingly, the parks prescription group that did not have any formal supported group visits actually saw a greater increase in weekly park visits. And this really suggests that leaving park prescriptions open-ended may be more effective, especially for families who are facing economic and social constraints. And this finding is so important because it really shows that families can experience the benefits of nature simply with behavioral counseling and access to parks without the need for these organized group activities. Next slide. So our ultimate message is simple yet profound. Nature holds the potential for healing. But further research is still needed to fully understand and harness this power. This is really what guided me to conduct a systematic review, which aims to provide valuable insights into the effectiveness and scalability of nature-based mental health interventions for children, adolescents, and young adults. Next slide. So as we all know, the youth mental health crisis is a growing concern, with demand for services far exceeding the capacity of current treatment models. Alarming statistics reveal that less than 20% of youth in the US who are diagnosed with a psychiatric condition will receive services. Even at UCSF, we are currently facing year-long wait lists for children who are in need of care. Next slide. And unfortunately, these disparities in access to healthcare extend to nature as well. There are still numerous barriers that fundamentally prevent minoritized families from accessing nature, including ease of transportation, privilege of time and leisure, knowledge of where to go, financial costs, unequal neighborhood landscapes, concerns for safety, and lack of feeling welcomed. And this inequity in nature ultimately results in poor physical, mental, and social health outcomes for these communities. So for us who work in patient care or educational settings, even if nature was the perfect solution, we still have the issue of how to get it to the people who need it the most and who we support. Next slide. So as a child and adolescent psychiatrist, my goal is to identify practical and universally accessible strategies to combat the mental health crisis in children. And this is where nature comes in. Next slide. Nature-based interventions offer not only a community-based solution, but a practical one for this crisis. They are accessible, inclusive, adoptable, easy to learn, and cost-effective. So it's crucial that we assess the scalability and inclusivity of existing nature-based programs to determine how many of these programs are truly accessible to families and ensure that they're designed to be welcoming and available to everyone. Next slide. To better understand how to implement this, I'm currently collaborating with my mentor, Dr. Rosani, to complete a systematic review that focuses on nature-based mental health interventions for youth. And our research question centers around gathering and analyzing existing research to understand which nature-based mental health interventions in youth can be effectively cataloged and scaled for broader implementation. And essentially, we'll be using different parameters with the framework created by Dr. Enola Proctor to look at that. Next slide. And our ultimate goal is to use the results from our study to design a scalable therapeutic care model to impact mental health outcomes at the individual and population level. And by understanding the impact of nature on mental health and identifying successful intervention approaches, we can actually work towards incorporating nature into our clinical and educational practices and thereby promote the mental health and well-being of youth. Next slide. Now that we've explored the importance of and potential for nature-based interventions, I wanted to discuss practical ways that you can integrate these insights into your interactions with patients, students, and families. So the most important thing is just to start talking to families and patients about their time in nature. So the strategy used by the Center of Nature and Health at UCSF Oakland is the Mnemonic Explore. And they developed a model to talk to families about nature, which is really based on motivational interviewing, which is a common counseling method used by clinicians. So first is to explore the individual's experiences. And because nature experiences can vary greatly across cultures, it's essential to approach this with cultural humility. Taking the time to genuinely ask individuals how they define nature, whether they prefer the term park or green space or have other perspectives. And let the patient and their understanding of what nature means to them guide the interaction. Not everything is going to be, it might be a park visit or just a time in the garden. It doesn't always have to be something that's adventure-based that feels maybe less accessible to certain families. The next is to understand their physical and mental health, because maybe their child is in a wheelchair, so they need something that is easily accessible with paved paths, or perhaps they have some significant anxiety and there's resistance to new experiences. By understanding this, you can help them prepare and plan and know what to expect, and perhaps teach them some skills to use in nature, such as mindfulness. Then you can ask about limitations. So is there anything that you can ask, is there anything you feel that's out of your control that influences your ability to be outdoors? Then some common barriers I think that we talked about earlier, the transportation, time, knowledge on where to go, financial resources, maybe entry fees to parks might be a barrier, having no parks or nature near the patient, concerns for safety, lack of feeling welcomed, lack of interest, and being prepared for a preference for screen time over outdoor activities. Then exploring opportunities and just asking, does your child have access to outdoor spaces to play, and perhaps providing them with some resources to get outside. Then resolution and making a specific goal, and then evaluating and following up. And this is an easy way to kickstart the conversation and explore how we can incorporate more nature into families' lives. And they really seem to appreciate it. And it is important to remind families that for children, engaging with nature doesn't, again, have to always involve this elaborate excursion. Even local nature in their yard can provide a really rich developmental experience for the child. Next slide. And this is a very interesting and great resource. It was developed again by that Center of Nature and Health at UCSF, and it's a guide for healthcare providers and any professional that they can download online. It's a great starting point for professionals who are interested in integrating nature into their practice. And this report reviews current literature on the health benefits of nature and discusses common barriers to getting outside. And it includes actually what we talked about in the previous slide about ways to talk to patients about nature engagement and other strategies to integrate the outdoors into clinical practice. Next slide. So our aim is to bridge the gap between research and practice and ensure that nature-based interventions become accessible and impactful for those who need it the most. And I'm hoping that together we can embark on this journey to explore the possibilities of nature-based interventions in youth mental health. And by overcoming the challenges of implementation and scalability, we can maximize the healing potential of nature and create a brighter future and well-being for our youth. Next slide. Thank you so much. Thank you for having me here. Special thanks to Lauren Shook and Dr. Esther Walker for inviting me here today. I also want to take a moment again to acknowledge my mentor, Dr. Razani, who has been at the forefront of nature research and has been instrumental in my journey to learning about nature. Thank you so much.
Thank you so much, Dr. Sharma. That was an amazing, amazing talk. I think a lot of people here in the audience will be able to put a lot of that research into action right away. We have time for just a couple of questions. One that's come in virtual, but I think Andrew's actually here as well. But maybe I'll paraphrase it here. And so he was curious that, okay, we know, nature has positive effects on mental health. Physical activity has positive effects. We have a lot of PE teachers here. Would you hypothesize, or is there any evidence to suggest that taking the kids outside for something like mountain biking may be better than staying inside in the gym playing basketball all day, for example?
Yes, I think in the systematic review, there's many different studies that have looked at mountain biking and cycling and even surf therapy and just various types of green space, blue space. And it has been shown that really getting kids into nature, even if it's the yard in school, has been mental health benefits compared to staying inside.
Thank you. And I think we have time for one more question right here.
I was wondering, since your ending slide was like, join this journey with us, is there something that is an easy, part of an onboarding process where we could integrate a survey or something for families to understand nature and be educated? Like with our organization, we have this big onboarding process, but we feel that would be a beautiful thing to integrate for the parents to feel more understanding of why we do outdoor activities.
Yeah, that would be really wonderful. That is something that I'm actually trying to work on with Dr. Razani, is find a more comprehensive and accessible way for us to talk about nature, for not only in the clinical setting, but also to offer different programs. So as we come up with it, I'm happy to send it to you guys, because I think it would be very nice to start facilitating that.
Thank you so much. And we will put together a lot of these links and resources that Dr. Sharma mentioned and send it all to our attendees. And of course, anything that comes out, send it our way, and we'll be happy to share with our audience. So thanks again, Dr. Sharma.
Thank you. And feel free to email me if you guys ever have questions.